Symptom of estrogen excess: headaches, poor sleep, panic attacks, swollen breast. They're still cycling heavy cycles. Of course, women that are estrogen dominant do have an increased risk in breast cancer. Autoimmune diseases. There are now 104 autoimmune diseases. Some of them are hormonally related. Rheumatoid arthritis and lupus are autoimmune diseases of estrogen excess. Hypothyroidism can be a symptom of estrogen excess. And don't you see more and more hypothyroid patients all the time? I do too. Fatigue, irritability, mood swings, fibroids, bloating. Taking too much estrogen, of course, can cause estrogen dominance. True story. One of my patients was seeing a, quote, natural doctor. This physician did not understand that hot flashes could not only come from estrogen being low, but it could come from adrenal fatigue, because that particular physician never studied any of this. He kept giving her more and more and more Biased. Everybody knows what Biased is, right? 15 milligrams of Biased later, she came into my office and we did a salivary test on her, and I'm going to talk about testing in a few minutes. Normal on the salivary test I was using for estradiol was 6 to about 20. She was at 88,000. So do you need to measure? Of course. This person had estrogen dominance because of what a physician gave them. It's all about balance. If the patient doesn't exercise, they can become estrogen dominant. How many of your patients are couch potatoes? A diet low in grains and fiber. So the Atkins program is a setup for estrogen dominance. Of course, there's environmental estrogens. I have one right here, right? Particularly if you take this plastic and you microwave it, or you take and freeze it. This is a phytoestrogen. You can now, by the way, measure phthalates. There's a testing company that you can measure PCBs, dioxins, phthalates, and all of those things. So we can actually tell the patient what they have. Elevation of 16-hydroxyestrone we'll get into. Synthetic estrogens like Premarin. Premarin is 1/2 E1 and 1/2 E2. E1 is estrone, E2 estradiol, E3 estriol. E1, this one is the main estrogen the body makes postmenopausally. This is also the one that most scientists believe increase the woman's risk of breast cancer. E1. Also, if the patient is overweight, they make more E1, and estrogen is stored in fat cells. E2, estradiol, it's the 400 functions we've been talking about. E3, estriol is 80 times weaker than estradiol, and considerable evidence now shows that it helps protect against breast cancer. Experimentally, and I underline experimentally, E3 estrogen is being used to treat breast cancer, first done in Europe. There are some ongoing trials here. This is experimental. E3, because it's weaker, does not have the same bone, heart, and brain protection, however, that estradiol has. What does E3 do in the body? Well, it helps maintain pregnancy. And that's when the level of E3 estrogen is the highest that it can be, is during pregnancy. E3 benefits the vaginal lining. It blocks E1 by occupying the estrogen receptor sites on the cells of the breast. It controls some of the symptoms of menopause. It decreases LDL and raises HDL. It also reduces pathogenic bacteria. It restores the proper pH of the vaginal vault and helps prevent urinary tract infections. E3 also helps the GI tract remain with very favorable flora as well. E3 estrogen is now being used to treat MS. When does a woman get exacerbations or diagnosis of MS occur? Commonly post-delivery, when E3 goes to nothing, and commonly peri and postmenopausally as estrogen changes. That's from Neurology 2002, Neurology 2004, E3 estrogen for women with MS.